Good morning, everybody. On behalf of Oxfam India, I welcome all of you and a big thank you to begin with the webinar today. A thank you in the sense because, we start this webinar with a bit of a heavy heart that as a nation, we are going collectively through a crisis, a massive one, probably at least in my lifetime, I have never seen one. Almost, I guess, every one of us, either us, ourselves, or someone in our family or friends are surviving through the pandemic, struggling. We were a bit hesitant to do this webinar at this point of time, yet we thought that it's very important also to talk about certain issues which should not get cornered at this point of time as we trundle through a massive health crisis. There are two major reasons we thought that we should do this webinar today. Today being May 1st, International Labour Day, our salute goes to all the frontline workers who are out there relentlessly trying to help us out to tide over this pandemic. Also, another major reason that last year, probably during this time, we had seen thousands of migrant and informal workers walking back home, unable to find a place in their workplaces in bigger cities or wherever they work, and then had to go back absolutely devastated. It is during this part of the year, this time of the year, while we see a massive health crisis almost taking turn to a carnage, must we not forget that India's informal sector workers and migrants workers will receive the double whammy, not only of surviving a health crisis, but also a crisis of losing their jobs and any social protection that we fail to offer to them. So with this in the background, we thought we should bring back on the table the issue of social protection and informal sector workers. I just want to give a bit of a heads up that why Oxfam is doing it. We are trying to begin our work on informal sector workers from this year onwards. We have already our work with Assam tea workers and the sugarcane migrant cutters in Maharashtra and Uttar Pradesh. And from this year onwards, we'll begin our work with informal sector workers in the major cities of Bangalore, Delhi, Pune, and Mumbai. While our program work unfolds, we have already begun our humanitarian work, reaching out to people who are in most need at this point of time. So in today's webinar, we will discuss the ever-growing importance of social protection for informal workers and migrant workers. I wouldn't delay this webinar anymore. All of you are waiting now. Joining us today is a very esteemed panel. Professor Babu Matthew from National Law School of India University, Professor Ravi Srivastava, Director for Employment Studies, Institute of Human Development, Preeti Bhattacharya, Director for Center for Worker Management, and Uli Daniel, Director Migration and Education, Aid at Action, South Asia. And today we also are glad that we have Udit Mishra, Deputy Associate Editor, The Indian Express, who's going to moderate the panel. I'll come back at the end of the webinar once the discussion is over. I request all of you to be a bit interactive once the discussion is over. Do post your questions and we'll take forward to the panelist. So Udit, without much delay, over to you to have the interaction with the panelist. Thank you once again.
Thanks, Ranjana. Welcome everyone. Welcome to the esteemed panel. As Ranjana has said, today is a significant day, and also this is a significant time to look at the issue with the informal sector and migrant workers. Many of you would know that there's a general understanding that in India, most of the workers are in the informal sector. So this is not about some minor small matter that we are talking about. This is bulk of India, and this is the India that is worst affected by the pandemic. However, the purpose is also to understand what are the structural flaws. Pandemic might have made some of these things worse. And as many of you might know that just before the second wave hit, even the recovery was what is called a K-shaped recovery. It was better for the richer folks and much worse for the poorer or the smaller workers, smaller organizations. So we have to understand the context in which we are talking. and something significant happened a couple of days ago. The US President Biden said something quite remarkable. He said that trickle-down economics doesn't work. And this is a massive thing because this basically challenges the policy dogma that has been there for the last 4 or 5 decades, totally dominant. Every policy across the world, because US was following it in the name of Reaganomics, and UK was following it as Thatcherism, dominated the discourse everywhere. And even in India, that had a huge impact. But whether that works or not is open to question. And in fact, with growing inequalities and with large sections of workers not getting their due, the tide perhaps is turning. And we'll when we're talking to our panelists, we'll also get to know how COVID is sort of making that transition faster. So let me first, I wanted to break this webinar into two parts. First section, smaller questions on setting the context on what we are talking about, and then the second half of the webinar on more substantive issues about what is happening because of COVID. Can we start with Professor Ravi Srivastava, if I may? I wanted to ask you, Professor Srivastava, to give us a context of what we are talking about when we're talking about the informal sector and the unorganized sector. These terms are used interchangeably, but we do not always understand the importance of what is informal, what is unorganized, what are the numbers we are talking about. So if you could give a context to what is their contribution, what is the size, and then we'll get on from there. Professor Matthew, would you perhaps set the context for us to begin with on the informal sector? When we talk about the informal sector or the unorganized sector, what are we talking about? What is the size we are talking about? What is the contribution to the economy we are talking about?
Sure, Udit. That will be a poor substitute to Professor Ravi Srivastava. Whenever I participated in such meetings, I always want him to be in this part. But having learned from him, let me recap a few things that Professor Ravi usually says. First of all, from the experience of the work of the Commission for these unorganized workers, the one which was set up by the former Prime Minister, that commission pointed out to us that there are 500 million people in the workforce, especially the overwhelming majority of them, 93% of that workforce is in the informal sector. So it's only the 7% of the workforce that belongs to the organized sector. And then there is no end to the methods that are used in order to classify who is organized and who is unorganized. But we largely know that, since I'm a law person, I come to it from a law angle. Establishments are used as a point of departure. If you are an establishment and if there are more than 10 workers in that establishment, generally you have the benefit of labor law, including social security. And so if you don't qualify for that, then you get out, you're dropped out of various labor law protection. In addition, a new technique that is now being employed is a definition clause, which makes a distinction between workers and employees. In the past, our experience used to be that if you are a worker, you are covered by the maximum number of labor laws. Now they've reversed it. A worker is marginalized. A worker is sought to be the one who is in the informal sector. And if you want all the other benefits, then you must qualify to be an employee as defined by the new law. Therefore, one way for us to take note of this is, if you look at social security, having examined all the 4 codes, I would think the best way to understand what is the game plan of the central government, I would use the social security law. And what do you find there? If you are an employee, covered by the definition clauses, then you will get Provident Fund, then you will get ESI, then you will get gratuity, then you will get maternity benefit, and you'll finally get employees compensation, which is the old Workmen's Compensation Act of 1923, Bismarck social welfare legislation. So you'll get all these five if you are in the organized sector. If you are in the unorganized sector, you're pushed out. You are explicitly pushed out. I wish they would say it in simple language. No, you'll have to do a lot of research to come to this conclusion that if you are not in the organized sector, then you have so many new names by which you are known. You may be a contract worker, you may be a building and construction worker, you may be a migrant worker, you may be a gig and platform worker. All of them together, what will they get? They'll get a second-class treatment so far as social security and social protection is concerned. They are governed by Section 109 of the Social Security Code, where you get 5 kinds of social welfare benefits from the central government and 7 from the state government. But there is no guaranteed income, no guaranteed resource for it. Therefore, that is and in similar manner, there is exclusion when it comes to occupational safety and health provisions, when it comes to wage provisions, when it comes to right to employment, etc. I can see Professor Ravi Srivastava, so let me yield and benefit better from his presence.
Okay, great. So, I mean, one of the terms that we are these days using for people who are left on their own is Atmanirbhar, and that is the new terminology. So, but anyway, let me just get back to Professor Ravi Srivastava. Great to have you here. I actually wanted to start with you on the context setting bit. When we talk about informal sector and unorganized sector, as you know, all of these are definitional issues first to understand. So before we move on, I just wanted your understanding also on giving us a context of what the informal sector and the unorganized sector's contribution to the economy is, what is the size, and then we'll move on to other questions like their existence and what are the issues. So if you could give us a brief, we have 5 minutes, give us a brief understanding of what are we talking when we are talking about informal sector, what numbers, what contribution to the economy, that kind of a thing.
Thanks, Udit. So, I would first begin by thanking Oxfam for organizing this on International Labour Day and May Day, which actually represents the struggle of the working class to achieve decent work. It began, of course, as you know, formally in 1889. The struggles began much earlier. And in India, the largest deficits as far as decent work are concerned are with the informal workers. Essentially, there is a distinction, Udit, between, as you know, between workers in the informal sector and workers in the informal economy. And what Babu correctly explained to you are the broad percentages of the informal workers in India, which is about 93%, people without any job security. There are about 10% who have some semblance of social security, but 93% of those, 93% of workers don't have any job security. If you leave aside, let's say 10% of these who are in the top echelons, professionals, those who have evaded the formal regulatory provisions and all that, we still have about 85% of the workforce, which we can regard as vulnerable, the broad vulnerable segment swath of informal workers. Think of the Indian working class as being pyramidal. So if you leave aside the top 12 or 13% or 15% of the top, which includes a part of the informal workforce, which is slightly more privileged, which is skills, which is more assets and so on, we are still left by about 85%. Of course, these are then variously segmented by levels of skill, by whether they are sedentary or not. And what we have seen during the past 1 year, the crisis affecting the informal workforce as a whole, but of course, a great burden of the crisis falling on circular migrants. Whether they were partly had acquired a kind of a root in the urban areas, or whether they were continuously circulating as seasonal migrants, between urban and rural areas. They are vulnerable, broadly vulnerable, I would say, because they suffer from what we can call a livelihood deficits, livelihood vulnerabilities. Livelihood vulnerability is a broader term covering access to natural resources and natural assets such as land and so on. And there has been a continuously declining curve as far as rural and forest-based livelihoods are concerned. And then there is a question of unemployment, of employment risks and income risks. And although real wages may have increased somewhat, real incomes, but a lot of us believe that volatility in these incomes and employment have grown over a period of time. So it is this segment, and out of which the major segment being that of the migrants. And the migrants today, as I have shown elsewhere, form about 3/5 of the vulnerable workers, informal workers outside agriculture. Almost 60% of them are circular migrants. Okay, so if you compare the first wave and the current tsunami, because the incidence 2 days ago, case incidence was more than 4 times what the peak incidence was in the first wave. In the first wave, or for the first wave, the migrants, it was like a gaping wound. The lockdown, complete lockdown was like a gaping wound. Blood rushed out, and you saw migrants on the road getting back. What we now have is a slow bleed. A little better in terms of, because we don't see so many migrants on the road, public transport is running, but this bleed comes to the same set of people who had actually suffered from the major injury last year, whose families had to borrow. They had to borrow. They suffered from a huge income shock. And that income shock never really recovered, except for some contact-based services for which there was pent-up demand. Incomes never recovered. There was a big shortfall. And now on top of that, we have again the informal sector and the migrants facing a follow-up crisis with actually no support being envisaged. Even the very meager support which came between May and June, and a little bit of extended support which came between July and November last year, extended by the central government, has not been extended this time. So you have a case where they are totally unprotected. And that is why the question of social protection and social security has to be brought up front. Let me stop here.
Okay, great. So, I mean, the couple of words that I wanted to hang on to and move on to the next speakers. You talked about the vulnerability and the volatility in the job market. And I wanted to bring in Dithi and Umibai to get perspectives on what is this vulnerability about, So if you could, we'll start with Dithi first, elaborate a bit about the vulnerability of this existence, the volatility, and also, Dithi, if you could bring in some understanding on the gender aspect, and I'll ask Umibhai to bring in more of the understanding on the migrant workers, because those are two sort of overlapping sections. So if you could start, let's again chart out 5 minutes max.
Thanks, Adil. I think Babu quite laid it out quite well about what we are talking about in the informal sector. I think somewhere we need to be very clear about the fact that there is nothing actually called the informal sector. There are informal workers within the formal sector. There are informal workers who are part of the supply chain of the formal sector. The informal sector is actually is constantly subsidizing the formal, which makes the formal sustainable. If there is no informal, the formal would not be able to sustain itself. So this is a very interconnected and dependent concept. The idea of creating these two categories of informal and formal is actually to create a wedge between the two. It is actually to be able to reach a large section of the workers who are vulnerable and are made vulnerable, rather. They are not vulnerable. They are made vulnerable to make sure that there is a setup which is able to make the maximum profit. So that is something that I would like to lay out in the first instance. And then if we are talking about the informal definition of the informal, especially with our experience of the garment industry, I would like to come up with one thing, that the garment industry, according to the definition of what Babu was laying out, it is the formal sector. It is a formal sector which employs more than 10 workers. It employs actually, to some extent, if there are big factories where workers are working, or even when we're talking about sanitation workers. It's a huge section of workers who are working in sanitation work. But in both these sectors, we call the workers informal workers. There is no reason to call them informal workers by definition, but we call them informal workers because for the fundamental reason is that these are led by women. These are people who work, most of the people who work in these sectors are women, are Dalits. So there is a whole notion that where you can make people use any form to make workers vulnerable, you call those informal. There is no reason why a garment worker or a Safai worker in a municipality should be called informal, but they are termed as informal because you have the right to call them informal and you get away with it. So that's one thing that I would like to make. And the point that Babu made is very important, is about the Social Security Code. The Social Security Code for the first time says there are two categories of workers. One are workers who have rights, which is what he was talking about, who get PF, gratuity, and so on. And the others who are eligible to benefits under schemes. So you're basically pushing this whole large section of workers into a structure which is dependent and contingent on budgetary allocation. So they do not have any right to anything. They do not have any right to a health policy. They do not have a right to any social security provisions. They only have benefits and entitlements under these schemes. And what happens if you don't allocate any money for that? Sorry, you don't get anything. That's the whole idea. And in a framework where we are looking at governments which are committed to fiscal prudence, so where do you put in the money? You're not putting it into social security schemes. You're not putting it into social protection. And yet you're putting everybody into a category where they're supposed to derive these through the schemes. So you're basically creating an infrastructure of disentitlement. You're creating a mirage that you can get it, but we'll not give you money for it. So therefore you can't get it. It's not your fault. So this is one thing that is there. And the last thing that I would like to make a point over here is across the world, we are fighting this battle at this point of employers taking responsibility. But what we are doing, so with Uber, with Deliveroo, we are fighting across the world in countries for Uber to take responsibility of its drivers, Deliveroo to take responsibility of its riders. But in India, what is it that we are fighting for? We are fighting for their inclusion in these schemes. So there is also a kind of fatigue, I would say. There's a fatigue in the labor movement that gives them an easy way out, where we are always asking for rights from the government as opposed to from the employers. So under the PLA, in the Plantation Labor Act, there were rights. Housing was a right, water was a right, education was a right under the PLA. But the new Occupational Health and Safety Act is basically saying these will be given to you through schemes. So they're saying housing is there. It's not like they're saying that housing is being thrown out of the window. Housing is there, but it will come through the Indira Awas Yojana. Now, what does that also mean? That also means that a worker in a plantation labor, the plantation labor earlier had two rights. One as a worker, under which the employer was supposed to give them housing and so on and so forth. And the other was a worker as a citizen who could access Indira Awas Yojana and go out and get it. But at this point, the worker right has been replaced by the citizenship right. So you're basically telling the worker that your wage has been cut because the government is now subsidizing the employers. So I think somewhere we need to understand that there is this whole system that has been created and a structure that has been created to give employers a free way so that they don't have to take liability of their workers. And the government is going to take the responsibility but not allocate for it. I think I'm going to
Can't hear you.
Okay, thanks a lot. I got muted in between. So Diti, you made a very important point for me. Rights versus benefits, the distinction that how we are pushing more and more people into only the benefits class and totally on the decision of the political leaders, and not necessarily thinking in terms of rights. And that's a very important distinction, and we'll get back to that. Can I go to Umi Bhai now to understand the migrant angle to this problem that we are facing? I mean, it's a structural thing. So can you give us some understanding again on the migrant aspect, the migrant angle to the informal economy, and how it got, how vulnerable it is, or how it sort of gets impacted?
Thank you, Udit. Hope I'm audible. And today, again, May Day, and my greetings to everyone, and salute to large number of workers struggling and for the rights and entitlement. And wonderful to be with Professor Babu Matthew and Ravi Srivastava and Diti talking about this issue. Professor Ravi Srivastava has already touched upon the migrant a bit, and I'm also going to deal with the circular migrant, and I've been working with them for last so many years on the ground, and I've seen. When we are talking about, and Professor Srivastava says around 100 million, I think that's the circular migrants that we have in India. And census has already said 400 plus migrants are there in India. It's a huge number. But still, I think it's very difficult to find out the poor people who are migrating out from the villages to the cities. It's very difficult to capture. And the economic survey of 2017 has captured something that even Professor Ravi Srivastava knows. They identified around 9 million people who have actually moved to the cities from around 75 odd districts in India to the cities to work. And basically, like when we are talking about circular and seasonal migrant worker, they are actually engaged in precarious employment, the kind of employment where they don't have any social security, the wages are less, the exploitative practices, and all these things are there. And large chunk of people who are actually engaged in the work, I think seasonal migrants are the Dalit, tribal, backward, unskilled, debt-ridden, women, child labor, you have adolescent labor. I think you have all kind of people. And the two ways, like we could say that the distress or the area from where they are coming. Udit, I could tell that last time the government has said that 10 million migrants have gone back to maximum kind of no state, but there are 5 prominent states where the people have gone. And these other states are UP, Bihar, Jharkhand, Chhattisgarh, West Bengal, Orissa, Rajasthan. And these are the states where also, like we sometimes find the poverty are much higher. And then we see that the persistent deprivation, the poverty, the systematic denial of decent living condition, and all this government entitlement that we talk about, basically like addressing food, employment, and all. And then aging migrant labor, also they face a higher degree of exclusion, denial of workers' right, and pushed into slavery kind of situation. I have been working with the Brooklyn workers for quite some time now, and we have also worked with around 1,200 released bonded laborers from Brooklyn's, and we could be able to see that what was happening to them. And the precarious employment, which actually in India, that you can say, particularly the Brooklyn, the stone crusher, the construction sectors, you have all like men, women, everybody the migrant. I would bring in a very interesting study that Ministry of Tribal Affairs, MOTA, has actually released a report. In the 2017-18, they've identified around 4 states, and they wanted to assess what is the tribal migration situation in this area. These states are Chhattisgarh, Madhya Pradesh, Jharkhand, and Odisha. These are the districts were taken, and I think majority of tribals are from this district. Very interestingly, the study says, like in Chhattisgarh, out of 10 persons, 7 are a migrant. Equally, also the Jharkhand is also out of 10, 7 people are migrant. No, Jharkhand, it is around 9 out of 10 are migrant. Odisha is 9 out of 10 migrants. Madhya Pradesh is 7 out of 10. So what does it mean? Why this suddenly, this tribal area, such a huge migration is taking place? Where they are going? What happened exactly? Why they are not getting employment and all? This is the study that I was looking at. It was done in 2017-18, much before the pandemic. Now, when we look back, I think during the pandemic, we were doing a study in Orissa in some district where Orissa has said around 10 lakh migrants have come back. During July and August, we were doing a study and we were asking people, what is their plan all about? September, people said they're going to go back to the work, mostly the tribal area. Unskilled, they don't have much skill to actually work, and the kind of multiple vulnerability they have at home as well as at the workplace. Both the place, like when we see them closely, these are the issues are there. I would actually bring you another more interesting study, this caste census survey. During the census, there is a caste economic survey was done. Again, this is even we are going for another census now. This caste economic survey has identified 135,000 bonded laborers in India. And Ministry of Tribal Affairs had actually identified, the census has identified this. And we are now actually raising this issue. No one knows where this 135 migrants have, not migrants, they are actually bonded laborers, have gone. So you can see the vulnerability among tribal, among Dalit, unskilled laborer, those dependent on, like Professor Ravi Srivastava said, those dependent on agriculture, those dependent on natural resource kind of based, the fishing community that we are looking into, the huge, I think in Orissa, large number of fishing communities have started migrating out. We have done some time back a study in Chilika, which is actually the powerhouse of kind of ecosystem where you have more kind of fishing happens. Large number of people are migrating, and then you have the natural disasters which is happening again and again, that we see that whether the coastal area, whether you have a cyclone, whether you have a continuous drought, mostly I think the tribal area and semi-arid area, it is pushing people out from their habitations. And what we have seen, the kind of the picture during the pandemic, the infant, the children, the adolescent, the women, everybody that they were actually running back to the villages. I'll come back again. What happened during that, as you said, during whatever, during the pandemic or the first pandemic. But I would say, why such huge exodus is happening? What is wrong with the source area or the livelihood, or why this distress migration is happening? Is it because of simply an aspiration kind of migration, or a distress that we're talking about? Has the social protection basket whether you call it a food security, social assistance, health, Narega. I will come back with Narega after some time. The farm support, pension, insurance, and a whole lot of basket, whether all these things have paid. Yeah, thank you. I'll stop there.
Okay, great. So, I mean, between all the speakers, I hope the listeners and viewers are getting a sense of the scale of the problem, the nature of vulnerability, and the element as Umibai just mentioned, that migration is not aspirational; it's out of distress, and it is again the worst affected are the marginalized communities across the board. So now let me come to the essential topic of this webinar is on social protection, and I would like to again circle back to Professor Matthew and again Professor Srivastava. But first, Professor Matthew, on what is the I want to if you could share your understanding on the architecture of social protection in India. We know by all these experiences what is the thing that we ail. For example, we ail with say skilling, or even what are the communities that are affected, what are the resource problems they have. So given all of that understanding, what is the architecture we had, and then we'll later on move to how COVID has made it worse. But for the timing, if you could quickly give us a understanding of what is the structure of the architecture of social protection in India, what all comes under it, and and speak a bit about what ails with it in general. But then we'll come to COVID later. I think you're on mute, sir. No, sir, you are not audible yet. Can the organizers unmute him? Yeah, I think now you've been unmuted.
All right.
Yeah.
So I was saying that in order to understand the architecture of social security, the two codes which give us special insights are the Social Security Code and also the Occupational Safety and Health Code. So these must be contrasted with the laws that we have repealed. And I think it is in that comparison that we can see a substantial shift. I begin with the occupational safety because that's the one about which overall there has been lesser discussion. And I think it does help us to gain some additional clarity. So from that point of view, first of all, occupational safety legislation, it made an attempt to take away guaranteed 8-hour work. During the first attempt, that is bill number 186 of 2019, they stole the 8-hour statutory guarantee given to us by the Factories Act. Please note that in 1919, ILO's first convention is on 8 hours work. Before independence, it is Dr. Ambedkar who introduces an amendment to the Factories Act in order to make 8 hours a statutory limit so far as India is concerned. The first social security OSH code attempted to take it away. The Director General of the ILO writes to the Prime Minister pointing out this, and then 8 hours is restored in the OSH code. Today being May Day, I think we must particularly take note of the fact, because it is after 135 years of struggle that we still continuing to talk whether 8 hours work is legitimate or not. Anyway, the Prime Minister appears to have conceded that aspect. Also, I want to quickly say, so far as substantive rights of labor are concerned, the only right which was restored appears to be this 8-hour one, and that at the intention of the ILO Director General. Tripartitism has fallen apart. So far as other rights are concerned, trade unions may have spoken here and there, they have not been heard. It is the employers who have been heard. and their expertise has been beautifully brought into legislation from the point of view of the employer. There are two kinds of legislation in India. One is general legislation, the Trade Union Act, the Industrial Disputes Act, the Industrial Employment Standing Orders Act, Minimum Wage, Provident Fund, Maternity, ESI, and please note, in this category, I think it would be correct to include Contract Labor Regulation and Abolition Act. It's not sector specific. It was tackling the phenomenon of contract labor. On the other hand, we've had sector specific legislation, and sector specific legislation have a long history. It has been incorporated through experience at a decentralized level. Many sector specific legislations which gave us social welfare, which gave security, which gave better safety standards, originated at the state level. They are, utilizing fully the concurrent list structural formula. Today, the idea of concurrent list is being done away with. If you examine rulemaking, all significant rulemaking, delegated legislation under labor law was always entrusted to the state government. Now you search for delegated legislation in the Social Security Code, you can't find it. There is no more delegated legislation rule-making power to the center, even in matters of social welfare. Who's going to implement this social welfare? Implementation is the job of the state government, and delegated legislation, the very logic of delegated legislation and rule-making is in order to help implementation. And here they centralize that power. So look at the type of sectoral laws that are repealed. That is BD workers, construction workers, mine workers, transport workers, migrant workers, dock workers, cine workers, plantation workers, journalists, sales workers, all this law is repealed. So what we have achieved over several decades through the rich utilization of the concurrent list formula, that is now repealed. And in its place, is there any satisfactory replacement? No, it creates a vacuum. That repeal is not even on account of resource question. That's the biggest tragedy. That is evidence that the central government is anti-labor, because most of this legislation is the route through which welfare boards were created. Welfare boards raised money through various types of levy. The best example is the construction workers levy. In Kerala and Tamil Nadu, more than 20 sectors have welfare boards, and through that some welfare. Now that is destroyed. For what reason? You can't give them welfare, and at the same time you destroy welfare that they have been enjoying until now. So that's a centralization in the structure of social welfare, and the logic behind it is Delhi must control all social welfare. Perhaps it's connected with voting, because if a state government like Jayalalitha's government could give social welfare, then, that is popular method of gathering votes. So even that should not be left through labor law. Central government will now control it. So there is a huge effort to control. In the opening remarks, I had mentioned in relation to social security, it's the same thing. It's a more blatant manifestation. Others have also referred to it, so I won't repeat that.
Great. This is because this issue about centralization of the architecture we have now, when the crisis has hit, the center is now giving everything back to the states and saying, it's a state issue, you deal with the crisis. But in the architecture, it is fairly centralized and not even having the delegated legislation that you talked about. I would play the devil's advocate before throwing it to Professor Srivastava. And I want to play the devil's advocate to essentially include people who do not agree with any of the things that are being said here, which is to say that, this government in particular, it's been 7 years, and in the past also UPA government, but more particularly in the last few years, lots has been done. There is no end of schemes. I was going through some documents, and there are just too many names. There's just too many names to even, for a common person to even remember, for different things. and one can sort of be rained down with the number of schemes that are being given for the informal sector and for the MSME, for this and that. So I ask you the same question that I asked Professor Matthew, but hoping of a different angle to the answer, that what ails with the structure? What ails with the structure? And this is regardless of COVID, and then we'll come to COVID. I think you're muted, sir. You're muted, sir. Professor Srivastava, you're muted. Huh?
It will have to unmute me. Yeah, I'm unmuted
now.
So it can only be done through the administrators. Okay.
Oh.
So first, let me just dwell a little bit on the possible distinction between social protection and social security. Okay. Because, you know, these terms, and in fact, even the ILO in many places, these terms are used interchangeably. Now, in my view, there is a distinction, social protection, and there are two kinds of distinctions. If you look at the Universal Declaration of Human Rights, the right to social security is a distinct right. It's a worker-centric right. But there is also additionally the right to food, the right to health, the right to education, the right to housing. In my view, all these are part of a broader social protection structure. So social protection is a broader, in my view, a broader conceptual framework within which we have to look at rights and entitlements. Social security is within that ambit. Social security should continue to be dealt with from a worker-centric perspective, whereas social protection can and should be dealt with a broader citizen-centric life cycle perspective. This is important because however we broaden the definition of worker, there are large categories of work which get excluded from the definition of workers. For example, and this mainly concerns women. So for example, all the women who work in the unpaid economy as contributory workers are not counted as workers in any of the legislations. The women's work at home in the household is obviously not counted in any of the social security legislations. But obviously it's work. And obviously women who work either in the domestic or the unpaid sphere are entitled to social protection and social security. And therefore, we need to, I think it's also important to look at it from both these perspectives, a worker-centric perspective and a citizen-centric life cycle perspective, which covers from childhood to old age, irrespective of where the old age people, the backgrounds that they came from. That's the first, that one very important distinction that I would like to draw. This does lead to also a question of approaches. The social protection floor approach, which was put forward by the UN in 2009 particularly, was a social citizen-centric life cycle approach. But at the same time, we also have the social security and the growing ambit of social security, the definition of social security in the country. Now, basically, when we look at social protection, for example, includes a very important right to food. And where would we have been in this crisis without a National Food Social Security Act? Where would the rural poor, the urban poor have been, despite all the limitations of this, of NREGA, and so on and so forth? So that is something. Now, basically, the problem in India is, in particular, that we have a patchwork of social protection programs. Either they're designed as patchworks, or they are administratively created as a patchwork. Why is it a patchwork? Administratively created often because administrative criteria are used for selecting households and individuals. You have to be sedentary. You have to be part of the census, the socioeconomic census, to be listed in the SECC and so on. If you are, then you could possibly figure in the social protection, the list of beneficiaries. If you're none of them, you will not figure. And this criteria of who will figure, who will not, is not purely an administrative criteria. It is actually a political economy criteria. So it's ultimately the political economy who decides who will ultimately be listed as a beneficiary and who will get the benefits. And this is the second layer through which we have to go to. So this patchwork becomes increasingly more patchy as we go down. Look at Narega and look at how it is implemented by different states. How very, states which actually pride themselves on good implementation have poorly implemented the Manrega program and so on. So this is one thing. So there's a question of criteria comes in, and this criteria question is very important when you deal with vulnerable segments of the informal economy. Those who are living in informal settlements, those who are living in low-income settlements, who are ordinarily poorly documented. The migrants who are settlers in urban areas and who live in low-income habitations, who live in informal habitations, have virtually no documentation most of the time. They work through the informal networks to acquire a modicum of documentation over 15 to 20 years of time. Therefore, they are denied from, they're kept out, excluded from most social protection arrangements and programs. And then there is this vast category of 50 to 60 million short-term circulatory migrants. And these, because of the nature of the fact that they constantly rotate between the urban and rural areas, belong to none. They are not able to lay claims to the rural entitlements because they're not there. They're not part of the political economy. They're not able to lay claims to urban entitlements because they miss out on the urban criteria. So the basic flaws are beginning with the design, that we have a patchy design which is not universal, with the entire political economy which renders it far more selective in operation. And we see this political economy operating clearly in the way the Social Security Code has been defined in a narrow sense. And I think Babu has talked a great deal more about it. So I'm not going to say much more about it. And then, I just as an aside, I remember when, as part of the National Commission for Enterprises in the Unorganized Sector, when we presented the report on social security and recommendations to the then Prime Minister, he had one very insightful question. He said, what about migrants? And we then actually presented him a note of portability of our suggestions, how they could be made portable and applicable to migrant households in every sense of the word, three senses in which we define portability. So this is again a very important thing, which adds to the vulnerability of migrants and migrant families. So let me stop.
Yeah,
Udit,
thanks.
you
I was muted. So yeah, so that's very important. The patchy design and the selective approach that we have in the political economy, and why it continues for basic protections. Let me now jump to the meatiest part of the discussion, which is how COVID has now impacted this patchy design altogether. This architecture, which is flawed, which doesn't necessarily always understand the vulnerabilities, the volatilities, and is very patchy in its design, or very arbitrary in its approach, in its administrative implementation. So I would want to now come to Dithi and Umibai again on how COVID has impacted the social protection regime. So because you have the most ground up understanding of this, please share with us, Dithi first, and any understanding in terms of say gender or migrants would be greatly valued. Yeah.
Thanks, Udit. Well, I think I will start with I think the pandemic was just another element of what the government was trying to do. And it started not with the pandemic, but it really started with demonetization. Then came the GST, then came the pandemic. So it was a whole one after the other. So who caused it and how it was used is the question we don't want to get in. But finally, at the end of the day, the government has been able to use to its advantage every one of these that have come. So in in the case of when we look at the demonetization, GST, what did it try to do? It basically tried to formalize capital and informalize labor. So, and the pandemic actually gave a reason to do that again. And it actually provided all the infrastructure to do it again. So when the lockdown was announced, it was the small who were affected the most. It was the small that manufacturers, it was the small enterprises that all got wiped away, and there was a consolidation of capital that we saw. And that really is about looking at what is it that the government is really trying to do. The pandemic really accelerated the process that the government has been trying to do of formalization of capital, of consolidation of capital, while along with it, you have to bring in informalization of labor so that you can maximize profits over there. So that is something that the pandemic actually helped. And when we are talking about migrants, and I would actually not create migrants as a separate category, because at the end of the day, every one of us is a migrant, if we look at it. Every one of us is a migrant if we are looking at the wider world view. Now, the question is about privileges. Where in the labor hierarchy do you exist? So whether you will be then called a migrant or not a migrant. But the question that we are looking at is the pandemic really created a new category of privilege. The privilege of the people who can work from home, which is what Udit was saying in the beginning, right? That we are the people who are sitting at home and working. So we are those privileged workers who are not able to work from, we are able to work from home. But then there is a large category of workers who are not able to work from home. So these are the frontline workers, the manufacturing workers, the entire gamut of workers who are going out there and is being pushed into the face of death today. Because you have to go out there to work. The question of migration, if we are looking at it as Professor Srivastava was saying, is it's a question that we need to look at it from the question of surplus labor. Like at the end of the day, unless we are addressing the question, how do we really deal with the question of migrants? So migrants will continue to be there, and migrants will always be vulnerable, because we want those migrants to be vulnerable to create a wedge between those who are not migrants and those who are migrants. We know of factories in Tamil Nadu where people are brought in from Bihar and Jharkhand and put in factory lines because they can't talk to each other. So you cannot unionize. So how do you unionize a worker who's speaking in Hindi? When the union, actually the base union over there are made of Tamils. So the constant fear of losing your job, and therefore the migrants don't want to get unionized. And then for the Tamil workers, these are people who are coming and taking away our jobs. So there is this constant bitter battle that exists between migrants, but we need those migrants. If we have to have those migrants to keep the profits from overflowing. If we don't do that, then the consolidation is not going to happen. So we cannot look at migrants as a separate category of workers. We have to look at them as part of the structure which is essential for the profit-making process. And I think that is something that we need to, that is the policy problem that we have. We look at these people like some kind of giraffes in a zoo, the migrants. So we look at them as something different, but they're not different. They are part of the structure that we are talking about. The structure, the flawed structure that both Professor Srivastava and Babu were talking about, is that we need these migrants. And we will not be able to solve the migrant question till we are able to address the question of this structure that we are in. I think I'll just...
Right. Thanks a lot. Umi bhai, would you want to also weigh in on the how COVID has impacted social protections for the informal sector? I think you're mute.
Sorry. Yeah.
Yeah.
What happened actually, COVID has actually exposed the weakness in our social protection. And many of this is management, and nobody had any idea about how many people are there. Government of late also told, the floor of the house, they don't keep any data about migrants. And migrants started walking, and there's a denial. We never had any mechanism but to actually depend on the National Disaster Management Act to actually provide support to the migrant worker. We didn't have anything. And suddenly we got money. I think states were given money from State Disaster Management Fund to actually support the worker wherever they are. The message went, you stay wherever you are. And when 25th or 24th March, this is being imposed, and after 6 days, probably the migrant would have got their salaries, and you're imposing a kind of lockdown. People lost. There is a wage theft. People have actually lost everything. They didn't have wages. They didn't have any work. They were on the road. They didn't have money to pay the rental. And they started moving back. The transport was closed and everything. People came back. And when they reached home, they're stigmatized. Many places actually they were being sprayed by insecticide, like Egypt. They are the life carriers. I think they're moving, and these are the sites that we have seen. How migrants are being uh, like treated, both at stay at the destination and also at the source. And we have seen that how the people were actually kept in a quarantine center uh, inhumanly. Many places the food was not there, and so we have seen that. And when they come back, I think the issue was the social protection definitely helped people in elevating deprivation and also shock, but we couldn't find anything. Rather, later on it was said that look, 8 crore people were added to the PDS. I think this is the number that we have got. uh, and interestingly, I was trying to see that what happened, how the distress was prevailing that time. When we have seen in April and June 2020, uh, then MGNREGA 27 million households were added between April to June. I think that is what the number has gone up, and that's the record in India. I think the large number of people ever got employment under MGNREGA. And by September, 18 million people have dropped out from that. What does it mean? I think either the program that we have designed is not helping out people to continue their employment, or there are also places where the enough funding was as an issue. The budget was also not there, and many people have actually resorted back to the same place where they came back. And that was the only thing that, so in the name of social protection, we had that Narega and the food for 3 months, food for 3 months for 8 crores people. And then we have this Narega. And now I think generally Narega that we say uh, is whenever we see in the most kind of area where generally it is 11 million or something like this being people actually get to work during June. And that is that's another issue. And what happened, many of the state government have thought that they would actually have uh, migration commissions. I didn't know what is this migration commission all about. Like UP has declared that they will have a migration commission. UP has got the maximum number, around 3.5 million migrants has received. Bihar has received around 2.5 million. So they said they are going to have a migration commission. We don't know. Many states, they have got a wonderful database. I could see in Orissa, when the people came back, informations were collected at the different levels, at the panchayat level, at the quarantine centers level, and also on the website. These numbers were migrant database. But suddenly, within 2-3 months, people started moving back. No data were kept. I think many places the owners have sent buses to the state, like Kerala is sending bus to Odisha, to Kandhamal and other places. So to take people back to the different kind of garment industries or spinning mills, the brick kilns, the air tickets were given to people to go to work. And now what's happening now, these people are now sandwiched between these two, whether they will go back or stay back at the destination. Although there is a, but also there are a lot of preventive measures were taken up. But it's difficult whether the kind of preparedness that we had, the kind of budget allocation was there for the Narega, all these things. And I know Orissa has actually already declared food for food grain for people, but there's no preparedness. And the kind of TMC center, we call it in Orissa temporary medical centers, in many places are also the preparedness is not there. So basically the trust level, what we have seen that whatever migrants have undergone during the first wave, and we were talking to some of them. I think they are saying they don't know whether they will stay back or come back, because the situation today with it, the most of the migration source area, the pandemic is on high note. I think the infection rate in the rural area is also from wherever they are. I think you can call it UP, the source area, or the Bihar in remote areas. These areas are also having huge infection rate, and that is what the uncertainty is still there, whether the migrant would come back in this situation or not. I'll stop there. Thank you.
Yeah, thanks a lot for that. So this is crucial. We'll just take it forward. Some of the questions have come. Let's open it up for all the listeners and viewers. This bit about the source areas and how they are also right now in the midst of the worst impact of the COVID second wave. I'll just ask one. I'll start with this question on the source areas. This is just a second. Yeah, so Anang Negi from Odisha is asking, in spite of several laws and legislations, why the protection measures for migrant workers are not being taken seriously at source as well as destination states. So, Umi, would you want to carry on and explain why exactly is that happening?
Yeah, sure. What is the law that we're talking about? We had one piece of legislation, that the Interstate Migrant Workers Act. I think its architect was Orissa in 19 enacted this law, and later this became the national act. And I don't know, Professor Babu Matthew could have said that how this is being implemented. On 28th of this month, a very interesting thing that I'll tell you. There are some 28 laborers were abandoned by a bricklin owner in Telangana. And there was a civil society organization who raised this issue, and the labor commissioner gone and gave a so-called notice to the laborer, to the employer. All the law, Professor Babu Matthew will say that there was no license, no minimum wage, no regular payment. These are all actually labor commissioner has written around 10 questions that he has asked this employer, why including everything, the basic facilities, the house, and the safety gears and wages, lot of other thing, and there is a family living out here. And now this labor code has come. I think what we have seen, many of this act which are there in the Interstate Migrant Workers Act, maybe probably it was not implemented properly. I would say that it is missing many of these things regarding affordable and safe accommodation is missing. That is not a responsibility of a owner. And blanket exclusion of housing, water, and sanitation is gross injustice. Again, and that's the major issue. The OSH code has ignored migrants moving with the accompanying family, children. there are a lot of things need to be done because migrant law never actually recognize the accompanying family, those who live at the destination, and the role of destination. I know Professor Ravi Srivastava talked about uh, uh, the uh, the portability and what happened to one nation, one ration. Like now, you can just look at this declaration, the one nation, one ration. You know, we do when we know that the source area also the people are vulnerable, they're dependent on PDS, and the person who is moving to the city is also vulnerable. How you are going to manage both? You cannot have like you have to submit your PDS card at the source so that it will be given to you. Aadhaar card is important. So many kind of conditions are being done. Uh, and one nation, one ration is a long kind of a demand by civil society organization that the portability should be there. What about the portability for education, portability for ICDS services, portability for the women, those who are working with the men accompanying? So many of these laws, maybe it sounds very universal. ICDS sounds universal. Education may not be a universal kind of thing, but still it's a long road and laws are not there now. Last point I would say, I remember that I appeared before the parliamentary standing committee much before the pandemic in January, and we put forth that OSH code that parliamentary committee was looking at, and we argued to retain some of these laws which were there in Interstate Migrant Workers Act and make it more stronger. But what we found in the OSH code, only one page narrative about what migrant workers and how this law would be actually implemented for migrant workers. So I think this requires a lot of already this area requires a lot more attention so that the migrant workers' interest could be protected. Thank you.
Yeah. Okay. Thanks a lot for that. Now, next question I wanted to go to perhaps Professor Matthew. This question is from Alok Ranjan Mohanty, and he's basically talking about this whole talk about 8 hours per day being on the law, but he's talking about I've encountered workers in my hostel who work for 15 hours a day in a kitchen cooking for hundreds of students. So my doubt here is who talks on their behalf of their social security in terms of working hours. So they don't even know what clauses are there in the law. So I mean, it's partly about awareness of the law and then articulation and or representation of it. So you deal with the legal aspect of it. So can you answer that? About the lack of awareness and what why doesn't it sort of show up?
You're muted, yeah, Babu. Can't hear you.
Now can you hear?
Yeah.
Yeah. Okay.
Yeah.
Okay. Yeah. I think our experience with the whole of labor law is that implementation of labor law is directly proportional to the extent of unionization of workers. Where workers are unionized, there's even more than 100% implementation. Bonus Act prescribes maximum of 20%. There are so many companies in which you have taken 30%. So unionization, it's a rights-based approach. What is a trade union? It's an excellent instrument for the rights-based approach. And so since migrant labor, informal sector workers, the unionization is poor, that is the cause for this weakness. And what did it mean? When you form a union, then you take it up through collective bargaining. But I think that's very welcome. That is first preference. But we must now give attention to the second preference, and that is social dialogue. And that's why I like that this program is organized by Oxfam. Oxfam must take a lead in order to promote social dialogue as a complementary feature to unionization. Under the new legislation, there is only one good thing, and that is compulsory recognition of trade unions. We must use that to benefit. It applies to all sectors, including the informal sector. But that will be frustrated unless there is something else guaranteed with it, and that is secret ballot as the method for compulsory recognition. Instead, I am aware that during the process of rule making, they are promoting the method of verification, which is a bogus method. You will have a majority belonging to one union and recognition going to another union. So in every political activity in India, recognition is a political activity. In every political activity in India, electoral process or secret ballot is used. It may be in the local self-government, it may be in the registered society, cooperative society, it may be in municipal election, it may be in assembly election. When it comes to workers, they think that we are not entitled to secret ballot. And so there is a huge agenda to prevent secret ballot and replace it with checkoff or with verification. That must be resisted because that is contingent on achieving implementation of labor laws.
Right. So the next question I would like to pick up is from Rishi Nandan Garg, and maybe Diti can take a stab at it. He essentially wants to know, this government is here till 2024, and in the absolute short term, in the 1 year or 2 years, how do you sort of impact, this government's thinking, this existing government's thinking? So what is the way to sort of impact, influence them to maybe think differently on social protection for informal?
Well, I guess I have to say this. I don't have a prescription for it, but I would definitely think that what Babu is saying is exactly what I would like to repeat, which is I don't think there is any possibility of any social protection coming into the fore unless we are looking at it from a rights-based perspective. We are at this point still looking at schemes. We are still looking at how to get into these schemes. So we are not trying to intervene in what is we are just trying to intervene in what is given. So within the given space, we are negotiating. We are asking for one thing more or one thing less. We are trying to do it within the given negotiating space. What we do need to do is to break out of that given paradigm and look for a different economic and political paradigm. And that needs to come into the political discussion. That needs to come into an everyday discussion that we are having. This also needs to, we'll have to also look at one thing, that over the last 20 years, it's not just about this government, but over the last 20 years, there has been a concerted effort to criminalize the whole idea of a trade union. The idea of a trade union is about people who demand things which is not their right. They're asking for things that should not be their right. And that was like the height of this was at the Maruti struggle. And we've seen what happened at the Maruti struggle, that we have 13 people even today on a life sentence. So there is a concerted effort to look at trade unions and the right of workers to freedom of association as something that is a criminal act. And this new law, the new law that we're looking at, the IR code, though, as Babu said, that it does say that there is compulsory registration of trade unions, what it also says along with it is that if you are seen to go on an illegal strike, your registration for the trade union can be cancelled. So every strike anyway is a legal strike. No government is ever going to say that this strike is a legal one. Every strike is declared an illegal strike. And if the illegal strike is allowed, the government is allowed to deregister a union for going on strike. How do you really build unions on the ground? And I think that is where we need to find a strategy to create unions. We have to be willing to take the risk. We have to be willing to unionize at every ground. We cannot be looking for the shortcut. And I think that is where I was trying to say that there's a difference between schemes and rights. You know, somewhere we need to get out of this whole notion of getting entitlements within schemes and actually rights within laws. And that is where we need to look at and trade union intervention. How do we make trade unions? How do we say that everyone has a right to social protection, as opposed to when we feel like giving it to you, we'll give it to you. It's not like that. So I think what I would say is somewhere we need to understand that where is the problem? Where does the problem lie in unionizing workers today? In unionizing workers today, there is a fear of reprisal. There's a continuous and constant fear of reprisal. Nobody wants to join a union because they're scared. They're scared of losing their jobs. They're scared of a criminal case against them. They're scared of every possible thing. And there is fear of even being ostracized by the society that you live in. It's not even like it's only in your workplace. You go home, your entire society is skewed against you. They are trying to tell you, why are you doing this? This is a criminal act. So there is this whole paradigm that has been created. So what we really need to look at is, how do we break this fear? The fear is there because we are within an authoritarian regime. We cannot move out of that. So if we have to ask for rights, we have to look for rights to break the authoritarian regime. We cannot have rights when there is no democracy. We cannot have rights. We cannot have the right to unionize or the right to freedom of association when we cannot speak out, when we do not have the right to dissent. So what we really need is to fight against this authoritarian regime. We cannot say, oh, let us just get this right and we'll deal with the authoritarian regime later. It doesn't work like that. I think that is something I would like to say.
Right, right. Now, a couple of questions for Professor Ravi Srivastava. One is from Shubhrajit Rath, and he's asking a question that a lot of people have been talking about for a while now. He asks whether we can look at universal basic income to tackle the problem related to this formalization of capital consolidation that Diti talked about. So is universal basic income, is that the silver bullet? Okay, let's first hear on that, and then I'll ask the next one.
Yeah. Udit, why don't you ask the next question also?
Okay. So the second one is specifically on women. Rukmani Panda is asking that in migration story of the country, the identity of women as independent workers is invisible, both in policy architecture as well in practice. The issues of women migrant workers are also missing in conversation during this pandemic. How could you see this, and what are the solutions that can be offered? So those two questions.
So, Udit, before I answer these two questions, I'll just take a minute on something else, if you allow me, which is a more general issue. And the general issue is, we've talked about social protection in this webinar so far, mainly from the perspective of workers. But frankly, social protection is not a workers' issue. It's an issue which is critically linked to equitable and sustainable growth in our society. If you just see what has happened in the last few years and over the epidemic as well, in India, for example, if you look at the epidemic period, majority of the companies, the CMIE data shows that more than 70% of the companies, their profits increased over the pandemic year, over 2021. The number of billionaires in India increased over the pandemic period. The top billionaires in India increased their wealth and capital increased the most. So on the one side, you have this increasing concentration of wealth and capital. On the other side, you have this growing informality, growing vulnerability, growing poverty of the mass of people. And if you look at all the changes that have taken place since 2016, and Dithi pointed to the political economy of it since demonetization onwards, they have pushed them all in the same direction. Increasing concentration of formal capital and increasing vulnerability, risk, and poverty of the vulnerable groups. And in fact, if you look at the broader canvas under neoliberalism has steadily pushed the graph against the workers and in favor of capital over 20 to 30 years, more or less globally, with a few exceptions, a few periods, and a few countries. And this is the broad context. In this broad context, social protection is not only about workers, it is about distributive justice, it is about redistribution, it is about sustainable growth, it is about equitable growth. And that is why, to come back to your earlier question, our job is not to influence governments alone. Our job is to convince society that if this is the kind of society you want, then this is what you should stand for. And this is what I want to emphasize. Now, yes, universality, apart from the question of entitlements, and I would say legal entitlements, which Dithi has talked about, universality of social protection is key. It is key to design, it is key to portability, it is key to everything. But universality in the form of a universal basic income has a large number of inadequacies. In a society which is rapidly getting privatized, where all essential services from transport to education to health are getting privatized, and we are seeing what privatization has done in the middle of the epidemic. For example, to health services. People are paying up to 1 lakh rupees a day to save their kin. The public health system has collapsed, completely collapsed. In the face of all this, we have to talk about making public services and essential services available to all this, not to purely transfer this to in the form of a monetary formula which will rapidly be eroded and which will be decontextualized from the provision of essential services and public services, which is what universal basic services seeks to do. Universal basic income seeks to do. Therefore, universal basic income is an attractive proposition. It is a supposedly an administratively simple proposition. It is not a proposition which suits our economy and society at this juncture. And this is something we must certainly, take into account. And this principle of universality has to extend across gender, across the social and ethnic origins which exist in our country. And they should prioritize the more vulnerable groups first. I mean, targeting the more vulnerable is part of the principle of universality. It is not antithetical to the principles of universality. And that is why, and it is absolutely true, although women have been the victims, and even through the limited period of revival that we have seen, women have not been able to come back to the workforce, even to the extent they were part of it earlier. We don't have a gender sensitive policies. We don't have gender sensitive governments. Women have got invisibilized in their recent struggles into the pandemic even more than ever. And this is something we certainly need to address. And this we can only address by bringing an aspect of social justice and gender justice, which have been absent from our policy. And the last time, just to underscore, as a last comment from my side, none of this can succeed without mobilization. None of this can succeed through mobilization. Social is unless we mobilize workers, unless workers are mobilized, unless civil society is mobilized, unless society is mobilized around the right principles and not divided around caste and communal lines to give fillip to a majoritarian and authoritarian government, we will not see the light at the end of the tunnel. Thanks.
Thank you, Professor Srivastav. It's quite remarkable. The universal basic income as an idea is something that has attracted. It's one of those unique ideas which has got a lot of support from right and left across the board. And you hit the nail on its head when you say that if the provisioning is largely private, then just giving an X amount of money will not solve it. You have to have a structural answer to that. So thanks for that. Thanks a lot to each one of you. I will now pass it on to Ranjana back, but just last bit that I want to do is to go back to where I started from, and this is so potent that I want to repeat this to people who might not have heard at the start of the thing, of what President Biden said a couple of days back. He said that, my fellow Americans, trickle-down economics has never worked. It's time to grow the economy from the bottom and the middle out. Basically, he's telling and setting the agenda, at least for the US, and perhaps from that power of example for the rest of the world, to figure out that, where the focus has to be. And at a time when India is looking exactly the opposite direction. We are talking about wealth creators. We are talking about historic corporate tax cut, with consumption demand totally falling. It's worth asking, are we on the right track? It doesn't really help if you're going very fast in the wrong direction. So it's worth first checking whether we are going in the right direction or not. Thanks a lot to all the panelists, and I'll pass it back to Ranjan.
Yeah, thank you so much, Udit. I mean, I wouldn't also dare to summarize the discussion, because this has been fascinating on a day where we should, as I began, that render our salutes to all the frontline workers who are out there to help us tide over this pandemic. I'll just echo Professor Srivastav's sentiment that probably this is the time of mobilization and collectivization and stand up for what we demand actually. Do we demand for a society and a nation which concentrates wealth and tilted towards capital formation, or do we demand for a society or a nation which actually takes care of the vulnerable, be more inclusive, and work towards social justice from a social protection point of view? With that, I mean, on behalf of Oxfam India, I can only render thanks a lot to Professor Matthew, Deethi, Umi Bhai, and Professor Srivastav. We had reached out to you probably on a little short notice, but all of you have joined us today on a very significant day. So thank you so much. To each one of you, we will reach out as and on we shape up our work with informal sector workers. As I shared in the beginning, that Oxfam India has started its humanitarian work. We will be expanding that, but at the same time, we will also deepen our program. And to begin with, from very soon, we are also doing a very rapid assessment to understand that in 4 cities, what has been the extent of accessibility of social protection schemes by the informal workers and the migrants. And we'll reach out to you for your advice and also share out the findings to you. Thank you so much to all the participants, to the audience who have joined us today on this very significant day. We have recorded this program, and we have also sent out some tweets. If any one of you want to access this, do reach out to us. We'll make that available. So with that note, Udit, a big thanks to you for holding this and anchoring this and bringing out the critical points. So once again, thank you. And with that note, have a good day. Yeah.
Thanks.